This is an uncertain time for all of us right now. We understand you may have concerns about coming to a hospital in the midst of a pandemic. Our abundance of safety measures and visitor guidelines have become the new normal in our Methodist hospitals, and our care teams and patients are embracing the changes. Over the last few weeks, I've had the chance to walk by the halls and step in several patient rooms. It may appear that the hospitals are quiet and lonely right now, but I'm happy to share a lot of laughter and kindness is filling the void. Our nurses and doctors are caring like family and making sure that they're there for anything our patients may need physically or emotionally. I've heard stories of the nurses celebrating a patient's birthday complete with cake and balloons since the patient's family wasn't able to celebrate in person. We've helped many patients have face-to-face conversations with their loved ones using FaceTime. We're utilizing virtual technology so that our pediatric and adult patients can still take part in things like art and music therapy. And of course, the countless times of just being that friend at the bedside to confide in when a person's emotions are getting the better of them. This pandemic has reaffirmed my confidence in the Methodist Healthcare teams and their dedication to our patients' needs. As we slowly welcome more and more folks back through our doors for surgery, you're probably wondering what we're doing to ensure that our facilities are safe. April Tolson, our Vice President of Surgical Services, is here to tell us about the enhanced safety precautions taking place at all of our hospitals.
Your safety and the safety of others is a top priority. We're scheduling COVID-19 tests for all patients who are scheduled to have a procedure or surgery at our Methodist Healthcare hospitals. The day before your surgery, you'll be scheduled for a walk-in or curbside pre-surgical COVID-19 test at the hospital where you'll be having your procedure. A nurse will swab your nose and will send the test to the lab and call you with the results a few hours later. The curbside testing process should take about 5 minutes. If you're having an outpatient surgery, meaning you won't require a hospital stay, a visitor will be allowed to accompany you. You'll both complete a brief screening at the hospital door, will take your temperatures, and provide you with masks. We've reconfigured our waiting rooms and other public areas so that we can all practice social distancing. Rest assured, we are disinfecting high-touch areas like elevators, door handles, waiting room chairs, and more, many times a day. We're confident in our safety practices so that you can be confident in your surgery. Our operating rooms are cleaned after every surgery, and a deep cleaning of all surfaces is performed every night. In other patient care and public areas, including restrooms and waiting rooms, deep cleaning routines are strictly followed. We follow all CDC guidelines and infection control standards. We want to answer any questions you have. Just give us a call or talk with your physician. Thank you for choosing Methodist as your partner in care.